The next startup is from Israel.
Can you see the presentation?
Yeah, let's start.
All right, let's start. Good day, everyone. I have less than 3 minutes to show you 20 years of R&D and several amazing discoveries. My name is Nimrod Elmich, and I'm the CEO and founder of Proteimax. Proteimax is all about peptide innovation. We developed a method of screening and identifying peptides that actually can drive huge value and can bring some cure to some of the most pressing problems of humanity, as you'll see soon. Sorry. We bring solution to real challenges. Our current pipeline has library of 54 peptides. Each can create better life, and we are focusing on 3 in the next 24 months. I'll speak of 2, PEP19 and PEP44. PEP44 is a peptide that actually kills any bacteria, fungi, or mold in the open air. It does not operate inside the human body, and so we figured out this is the perfect and most effective way to extend shelf lives of fruit and vegetables. You can see a test we conducted here in Brazil, 40 degrees Celsius on strawberries, and what it means to tip it in this material. The other peptide, which is most advanced, is PEP19. And this was identified in mammals when room outside dropped below 10% Celsius, and it just triggers the conversion of fat into energy. And you can see oral treatment that we gave in 3 days is as if human lost 20%, sorry, of his fat tissue in 3 days. PEP19 also is a grant patent in North America, in Europe, and as of last month in China as well. And the patent covers every combination of the molecule we call PEP19, which is 10 amino acids. A little bit about obesity, which is what we call the real epidemic. People used to be lean, 10% body fat. Today you can find people with 50%, and obesity is the mother of all illnesses. And none of the solutions today provide something sufficient to fight it. Now, I'll try to dip in and show you why we think this is a selective peripheral fat loss. PEP19 works in the fat tissue. It turns white adipose tissue, which is pure fat, into brown adipose tissue, which is pure energy, and it converts it into heat, and that's how it works. You can see the differences on mice on the right. After 3 days of treatment, you can see the striking result that we received with all metabolic parameters. And again, the implication, 20% loss of fat in the body in 3 days. It also flattened the glucose curve and reduces fasting insulin. You can see the level of glucose dropped here in 40% in a 30 minutes, what we call serum test. And as we predicted, substantially lower levels of fasting insulin as well, which again have huge implications over many diseases. Our market opportunities are endless. Almost any food can become a PEP19-based food and a healthy food, a relatively very easy regulation path, it's a natural molecule, and very low cost of production. So when we say we have a real solution in the war against obesity and type 2 diabetes, we mean that we can provide you food that doesn't make you fat. Thank you very much. I just remind you that PEP19 is a tip of an iceberg. We have 54 more peptides, each a unicorn by itself. Each can create better life and healthier life for people. Thank you very much. Any questions?
Thank you, Nimrod. Just do not bring microphone so close to the mic.
Oh, sorry. Sorry about that.
Disappears. Thank you.
Nimrod, I wanted to ask a question. What is the market share we're talking about?
Well, depends on the industry. We go to the food and beverage industry first. Market share is enormous. Every fat food can become something that doesn't make you fat, but we go then forward to the pharma industry, especially with other peptides that goes directly to pharma. Also with PEP19, we go directly to pharma after the food industry. It's part of the process to get the food additive and then continue to pharma. So the market share can be anything the Excel would suffer. There's no such thing.
And did you get FDA approval?
We have quotes from 3 of the major companies worldwide. One of them in Israel, one is Charles Rivers, another one in Ireland. And we know it takes 6 to 8 months and less than $1 million to get FDA food approval in a root called grass, because it's a natural molecule, because it exists in the human body, because it exists in fruits. So unless we want to do claim, we don't even have to do human trials, human clinical trials, only if we want to base a claim. So it's really fast.
Any exit strategies?
Well, we are a technology company. We don't intend to manufacture nothing by ourselves. We have huge partners that are looking at us, like Nestle and other food manufacturers. We want to keep and stay small. We want to develop the 54 peptide, which some of them related to heart failures and others. And exit strategy, any industry that look at one of the peptides and want it, probably we will divide the company later on and go to an IPO or go to sell. It depends. We just want to make money right now. We just want to make contracts that take money, and the exit will show up.
Thank you.
Can you talk about your team?
Oh.
Yes, I can talk about our team, since we have a great team. Let me do. This is our team, a very experienced team. The 2 professors are well-known professors and specialists in immunology and in proteins. The team won't grow big. We're a company of less than 10 people. That's what we're going to stay, because we are a technology company and we have 54 kids to take care of.
Thank you so much for your presentation. Sorry, can I go first?
Sure.
Okay.
Go ahead.
Yeah. So my couple questions. So in terms of, let's say, the functionality of your peptide, have you applied for any functional food labeling, as you've mentioned that it has some effects on diabetes as well as obesity?
Well, the route for a food approval for FDA as a food additive does not require a claim. So
no, I know it doesn't,
yeah,
but I'm just asking, have you applied for a functional food label?
Not yet. It's part of the process for the FDA for the next 12 months to get the claim. It depends on what we want to achieve, because it's different quantity of PEP19 when you handle diabetes, when you handle fat, or even when you handle cholesterol or blood pressure. By the way, PEP19 triggers a lot of mechanism in the metabolic, what we call the metabolic syndrome. Each concentration and quantities handles better different sorts, so it's depend on what is the product for who it is meant to, and that way we develop the exact one.
Yeah, got it. So right now everything has been validated in vivo, like through animal models, or have you done any clinical studies to show these mechanisms of action?
We did all the clinical trials that we need for the food additive approval by ourselves, but it wasn't according to the GLP guidelines. We have to do it again. We did a lot of allergic brain influence so far with great results, but we have to go through all this again, and we decided to go through a turnkey project with one of the major companies, so we know it's something that we pay, we get the food approval, and we hit the market.
Okay, and just my last question. This is more of a B2B play, like you're going to focus as an additive, or do you want to develop products?
Exactly, B2B. We have no intention to try and become a developer, marketing, or producer of a product. We have so many partners who want to join us and turn their food into superfood, especially the ones who sells you those fast food and all kind of fried food. Everything is relevant for us, so we intend to.
So do you have a specific? Sorry, do you have a specific product in mind that you've already verified that it will work like well with?
Well, we had discussion with companies like CP Thailand who wanted to take it to hamburgers, but also wanted to make a bar with an exact doses. We spoke to beverage companies, the red and the blue. And of course, they are what they do for us with sugar, we can eliminate. So this is for them, it's like it's like a saver. So yes, we are with a lot of connections with the food industry. Of course, they all wait for the FDA approval as a food additive, which we're going to get in 8 months.
All right, thank you very much.
Nimrod, I have a question. You know, about 25, 30 years back in America, there was a product that was launched called as Olestra, and its trade name was Olean. Procter & Gamble, McDonald's, Wendy's, many tried it because all the fried food, this Olean would not let it go into the human body, much similar to the peptide molecule that you are developing. And I come from renewable sciences background, and I know. Can you tell me, and you know, initially the euphoria was that this is fantastic, but few years later, FDA and other countries had to step in to ban it because of its harmful side effects that were not studied. And you know, peptide, I understand this more as a scientist with all my inventions and working in renewable sciences in America. Could you tell me, and it may not be an apples to apples comparison, but knowing the significant hurdles, and I've been a part of that industry, why do you think that this peptide would get an approval, at least in the US or the North American markets, knowing the past history of a similar product that was launched in the market?
Yes, well, this is a very good question. And there's also another material called rimonabant that was, again, depression of appetite. The problem with all these, as the last example you showed, is that it passes the blood-brain barrier and hit the brain, which means all side effect you get is because this is small molecules that passes the brain. PEP19 is totally different. It's 10 amino acid, it's bigger than the size that needs to go, and we have no whatsoever with everything we check, no effect on the brain because there's no traces there. And the operation method of PEP19 is working inside the fat cells. Actually, it works only on excesses of sugar and fat in the cell. So it takes care of your fat in your belly, in your places, in organs that you have fat, but only in the fat. There is no reminders, there's no side effects, there's nothing. We double checked it so many times with many models to see that there's no effect, no side effect, not in the liver. So actually, and because it is a natural molecule, again, exists in the human body, exists in papaya, for example, in micro doses that doesn't do nothing, we know that the path is relatively very short. By the way, the trigger that PEP19 activates is the same trigger that famous guy Wim Hof activates when he jumped into icy water. So we got the same effect double times without the ice. That's it.
I would love to discuss this further, yeah? Thanks for your answers. Good luck.
Thank you very much. Let's move to chat. Thanks.
Thank you, people. Thank you, guys.
Thank you.
Okay.